Uganda's fertility rate stands at 5.4 births per woman, with 77% of its population being under 25 years. A population full of young people stifles the ability to save and reinvest into the economy to allow development. There is need to have a population restructuring so that there are fewer children and dependents and more productive adults.
The working group above 24 and below 60 is very small. Almost 80% of the Uganda population falls under the age of 24, which makes the average Ugandan a 15-year-old person. So what we need to do is move that to a situation where we have the working group between 24 and 60 being the largest part of the population so that they can support the elderly and the young. So what we have now is a high dependency ratio where the dependents are much more than the people who are able to support them.
The COVID-19 pandemic will have a severe effect on this particular ideal population due to the drop in the contraceptive prevalence rate.
The country's strategic plan for family planning up to 2020 projected that by 2020 would have a contraceptive prevalence rate of 50%. We're at 35%, so we're already behind. What COVID has done is interfere with access. Women cannot move to where there's family planning methods. For a while, as service providers, we couldn't move to where women are. There's interruptions in supply chain. With all of these lockdowns happening across borders, most of these things are imported down. It's really difficult to maintain service delivery. So the chances are that women who would have otherwise chosen to take a family planning method will not take it.
However, there is still hope for Uganda to achieve this despite the setback. If key investments are undertaken, there can be change in the next 10 to 20 years.
The end goal is economic development. So you want individuals who are productive, who can contribute meaningfully to the economy. You need economic policies that support them to do that. You need jobs need to be created so that they can work. And you need to give them education that is applicable within their country, within Uganda. So 3 investments in labor, in health, in education and skilling, while reducing fertility rate and birth rates.
Above all, there is a need for behavioral change within the communities in Uganda when it comes to sexual and reproductive health if quality population is to be achieved.
Our communities, a lot of people need to stand up to say, look, I think this behavior is not helping us. If we want to have quality children, 10, 20 years down the line.
This proposed ideal population is in tandem with the development of Uganda that hopes to transform into middle-income country over the next few years. Rita Kanya, NTV Weekend Edition.